prevention of sinusitis, I think is really important. And for patients or for people who are prone to these kinds of problems, nowadays we have really fantastic over-the-counter remedies to try to control the tendency towards sinusitis exacerbations. For example, fluticasone is probably the most readily available and effective topical nasal steroid spray. Topical nasal steroids work by reducing the reactivity of the lining tissue of the nose and sinuses. So, whether the trigger for sinusitis is viral or allergic or some non-allergic inflammatory irritant, there are many that we're exposed to every day. Topical nasal steroids are very effective in reducing the tendency of those insults to cause significant swelling of the lining tissue of the nose and sinuses. And they're really well tolerated because they are topical agents. They are really not absorbed systemically to an appreciable degree and can be safely used in almost anyone. The only real concern we have about those with frequent usage, they can irritate the nose a little bit, and you can have nosebleeds as a consequence. And then certain segments of the population, like certain forms of glaucoma, you have to be more careful about topical steroid use. And there are options still. But as far as prevention, I think that would be a key one in someone who has chronic symptoms. And then, of course, managing allergies, because allergies are such a common trigger for the development of sinusitis. In fact, 70% of folks with sinusitis have allergies as an underlying factor. So there's a strong correlation between the two. And managing allergies appropriately is very effective in reducing the progression of those allergies to more serious issues like sinusitis.